Thank you.
Thank you.
My name is Mary Bussell. I'm CEO of TriMar Strategies. It is an honor to be back at GLOBSEC for our second annual health panel on the main stage. Health security is economic security and national security, which is in turn global security. So there is no better place than to discuss these issues here at GLOBSEC. SARS-CoV-2 and the pandemic it spawned underscored the abysmal differences in countries' health systems' readiness to confront major health challenges. If we are to change this, we are required to have a tool to objectively describe the situation in each country, to facilitate the identification of best practices, and to enable and to inform policymakers to support and monitor improvements. GLOBSEC created the tool in 2022, the Healthcare Readiness Index. It measures health system readiness across the EU and all of the nations within the EU, and their ability to confront future challenges. So please join me in welcoming Martin Smatana, GLOBSEC Associate Fellow, to present the overall findings of this study. Thank you, Martin.
Thank you. Ladies and gentlemen, good afternoon once again. Yes, we are ready. So, COVID-19 demonstrated very clearly that quality and efficiency of healthcare system have profound implications on security, sustainability, and, well, basically, resilience of all countries. These three values are three core values of GLOBSEC, and for this reason, in 2022, we expanded into healthcare topics, since we originally wanted to look into what made some countries more successful at dealing with COVID-related issues than the rest. However, while we're working on that, we realized that even though most countries have not yet recovered from the horrors of pandemic, and yes, I'm still missing a clicker, so I would ask for a clicker if I may get, have not yet recovered from the pandemics, they are soon to face another set of issues which are likely to have even more profound and negative consequences, such as aging and rise in non-communicable diseases. The malicious thing about these issues is that compared to COVID, it does not take days for a patient to die. In many cases, the negative consequences will manifest in, well, months or years, and hence it is often off-radar to politicians, media, and, well, decision makers. Right? And I would now probably need more than clicker than before. But, but I can continue, and you can imagine what I am actually what I am describing. Nonetheless, for this reason, we at GLOBSEC decided that we want to change that, and we want to ensure that policymakers do not forget about the fact that we need to continue building resilient healthcare system. And for this reason, we've created an index, and an indicator which can be easily used by politicians, decision makers, and media to see and analyze easily the readiness of countries to face future challenges, to monitor the progress, to see the best practices, and to eventually improve quality of the healthcare service delivery. Firstly, we published this publication in 2022. It was originally focused on CEE countries, since CEE countries contributed to roughly 70% of all excess death per capita. Then we later expanded in 2023 to include all countries, because if you want to identify best practices, you need to look outside of the CEE region. And in 2024, we expanded into other areas such as neurodegenerative diseases, and we call it a neuromap. The readiness index itself is usually published before, a couple of days before the Tatra summit, which will be in autumn, but we already have the results, and I would like to explain them to you right now. But before that, I have just a very few words on the methodology, but really a few, because it's very complex. But basically, we are looking at 38 different indicators, which are grouped into 2 segments. Each indicator is measured, it is weighted and presented as a 1 number per country, which can have a value from 0 to 100, and logically, the better the number, the more ready country is to face future challenges. Without further ado, let's have a look at the results. And I know it's very small, but what's most important is that once again, Norway maintained its position as the country with most ready healthcare sector, followed by Netherlands, Sweden, Germany, and Denmark. On the other side of the spectrum, out of the 10 least prepared countries, 9 are from the CEE region, with the worst being Bulgaria, followed by Latvia, Poland, Romania and Slovakia, right this way. If you are interested in more details, of course, we will provide a presentation with the key information, but the most important is that we don't have sufficient time to go in detail. That's why I've prepared a very brief analysis which looked into what actually the best-in-class countries, the 5 that I mentioned, are doing. Right, so there are several means of analyzing, but as you can see, if you look into how the countries did overall in both Readiness Today and Readiness Tomorrow indicators, the 5 I've mentioned actually dominate in all parts. So the question is what we can learn from these best-in-class countries, and generally speaking, they have several common traits and features that we could discuss, but 5 of them are probably the most prominent and important, and I would like to discuss them in a bit more detail right now. So firstly, these countries perceive healthcare expenditure as an investment, not as a cost, because if you look into the 5 highest spender on healthcare services in the EU, 4 are in our best-in-class group. This is very simple. These countries are fully aware that you need to invest now to see the results later. These countries are fully aware that the healthcare sector is a value-creating sector, and in most cases, these countries are already seeing the results because they have been investing a lot over periods of time. These countries are the countries with the lowest levels of avoidable mortality, highest rates of life expectancy, lowest rates of infant mortality. So you can see it clearly. These countries believe that you need to invest to get results. Secondly, these countries tend to focus on early interventions, as can be well manifested by their approach to diagnostics. They have above average rates of CTs, MRIs, mammographs per capita and compared to the rest of the countries. But what's important, they are trying to focus on root causes of the issues. So they are focusing on determinants of health because they ultimately impact what the health outcome of a population will be. This is one of my favorite examples of Norway that looks into what proportion of death can be attributed to risk factors. And I know the letters are too small, but generally what this means is that Norway is in basically every important group of determinants of health doing significantly better than the rest of the EU. And the reason for this is that they implement long-term policies and they spend heavily when it comes to prevention and public health policies, as you can see on this slide. I guess it won't surprise you to know that all countries in best-in-class spend above average resources on public health policies, prevention and determinants of health. Moving towards to innovations, the best-in-class country could be described when it comes to relationship to the innovations as innovations are a friend, not a foe. Basically, I know this is very difficult to measure, but there are some proxy indicators that can be used to, let's say, analyze this. One of the indicators is EPFIA's rate of availability, as you can see on the slide, that measures percentage of medicines available after some time after they are registered in the EU market. And as you can see, the best country in the EU is Germany. Denmark is also among the top 5. Norway and Sweden are not in the top 5, but because of the, let's say, data-specific issues that they have. What's important is that all countries in best-in-class are significantly, the rate of availability is significantly higher than the average. And interesting enough, is that Czechia is actually very high. It's not in top 5, but it is 6th, I think. It has 62% availability, which is very, very, very good result. These countries are not only good in terms of, let's say, range of innovation available, but also in terms of how fast they adapt to the innovation. And once again, there is another proxy indicator, this time called average time to availability to medicines, which measures how many days it takes for that particular drug to be reimbursed in the country. And as you can see on the purple lines, once again, it's the best in the class, which are significantly better than the rest. Best-in-class countries also invest heavily into human resources. These countries invest heavily into human resources, even though they already have above average rate of nurses and doctors, as you can see on the purple dots. The reason for this is that these countries realize that you need to continue training, development of human resources, so you can extend the quality and range of the services into home care, social care, long-term care, palliative care, because all these segments of care ultimately deliver value. Last but not least, the best-in-class countries are the countries which have, let's call it, more stable leadership in the sector. And this can be easily measured by looking into how many months, on average, a minister spends in his or her office. Average tenure significantly differs, but once again, you can spot that best-in-class countries, on the map, the more blue, the longer he stays. And once again, the CEE countries are among the worst when it comes to average tenure. And this is very, very, very important indicator, because a short-term or frequent changes of ministers cause short-term behavior. It causes transactional behavior. It can disrupt implementation of long-term reforms and value creation. And this is one of the reasons why, if you graphically, visually correlate overall results of our index to the average tenure, you will see there is a close resemblance, because it's a very important indicator. I would love to spend more time discussing these 5 points, but I'm already running out of my time. So I'll just quickly summarize by saying that I'm not sure which of these 5 points you will take away from this presentation, but there is one I have not yet mentioned, and it is the fact that all these 5 countries have one other thing in common, and it is they believe that the healthcare sector is value-creating sector. And now I'm talking about the ultimate value that we have, which is the improved life expectancy and quality life, but as well the quality, the value that has spillover effects into other segments and ultimately at the economy as a whole. Problem is that there are significant differences in the way how this value is created and or lost among the countries. And as our readiness index illustrates, this situation is not going to happen or change in the future unless we act. And therefore, we at GLOBSEC believe that, well, since the chain is as strong as its weakest link, we need to join our forces together. We need to start working together to close these gaps, to make sure that all countries in the EU, in the region, have more resilient healthcare system, because we believe this is the only way how to make sure that we are all sustainable and we can compete as the region, as the EU with, well, the rest of the world. Thank you very much.
Thank you very much, Martin. And you will be talking tomorrow morning with more detail. So if you're interested, please make sure that you attend tomorrow morning's session with Martin. Thank you. Building on what Martin has shared, I invite you all, please, to open your Slido and complete the survey question that we will look at as we continue discussing this afternoon. And I am now delighted to welcome our esteemed speakers, where we'll focus on addressing the issues and opportunities facing Central and Eastern Europe within the confines of the next 3/4 of an hour. Yes, solving world problems. Last year, our panel, as one of the panelists will remember, we were on the barge, and I threatened to up anchor and go out into the middle of the river so we could continue our discussions. I think GLOBSEC took that on board and made sure I was really close to the main stage. May I please welcome Jakub Dvořáček, who is the Deputy Health Minister at the Ministry of Health here in the Czech Republic. Welcome. Tamara Schudel, who is the Vice President and Head of Global Policy at Roche. Welcome. Jasper Kunow, who's the Associate VP of Central Europe from MSD. Welcome. And Jozef, who's a member of the Executive Board for the World Health Organization. Thank you very much and welcome. So, in light of what we have just heard, it's clear that maximizing the health of our populations demands us to rethink how we look at healthcare costs. Thinking of healthcare as an expense or drain on national budgets is outmoded and short-sighted. We must actively work to rebrand this as a strategic investment that a country makes to ensure a healthy population and a viable workforce. Accomplishing this within the UN Decade of Healthy Aging provides an appropriate timing for this very focus. In very simplistic terms, if the population is not healthy, a country cannot be sure of having a prosperous economy, a reliable and steady workforce, earning salaries and paying taxes to help support government initiatives. So, Deputy Minister, you are on the cusp of celebrating your 1000th day in office and have overseen some major changes within the Czech Republic's health system. The strategic framework of healthcare guides long-term goals throughout 2030, through and up to 2030, while ensuring consistency in healthcare policies. How can this framework assist in the rebranding of health and healthcare as not an expense, but as a strategic investment?
So thank you first for the invitation. I always love to come to GLOBSEC, and we had this pleasure, to have a presentation of the GLOBSEC at the Prague House already more than half a year ago. It was always great to see those numbers, and of course, that one of those slides which were presented here about the survival time or average survival time of the Ministry of Health in our region. And you mentioned at the beginning we are 1,000 days there. Me personally, it's a bit less. I didn't plan it, to be honest. Yeah? I thought it would be much shorter, but yes, it's great that we get this chance, and I believe it helped us to overcome that crisis which came. And I have to say also that the Czech Republic, or let's say our team at the ministry, we spent quite a time at the beginning to manage the crisis. I mean, the Ukrainian crisis, the rest of the COVID crisis, and then we had the issue with the availability of basic pharmaceuticals, which is still lasting in Europe. And we're spending a lot of energy not just here in the Czech Republic, but also in the EU. And I have to say, I always see the connection of what we are doing here and what's happening on the EU level. So we always try to connect, what we do here, our national plans, with the plans, which are, let's say, designed, at the European Commission level, and it works. I believe, this is the right way, how we should move it forward. I can use the good example, the European Beating Cancer Plan and our National Oncology Plan. And yes, now we are designing more and more of, let's say, therapeutically based plans, which would help us to move it forward with, let's say, good thinking about how we should invest in those areas. And of course, you mentioned it, our overall plan, which is always, as some kind of frame, for what we are doing. But what I believe is most important, and it's again with close connection with EU, is the data which we need to really maintain the system to ensure that we investing in the healthcare, but at the same time, if we are investing in proper way, and the investment which we are doing are, let's say, then transformed in better health of our patients, our people. So definitely the HTA and the work, with data available are essential, for all our steps we do. And it was also mentioned in the presentation that we are quite far, with the access to innovation. It's not just about the pharmaceuticals. It's also about medical devices and screening programs and so on. It's also about the training of our medical professionals. We investing a significant part of our national recovery plan to this to the area of development of simulation centers and preparedness of the specialists. But at the end, what we also see, and I will be very short at the end, is that the data which we are receiving, especially about the new innovative technologies, are not always, the strong enough to justify the investment which we do. And you can see, on the EMA level, but also on the FDA, that yes, we are getting faster and faster to the innovation, but at the same time, the data which are available for those innovative approaches are not always strong enough to justify the really increasing price of the innovation in the healthcare. So there's a lot of things, which we still need to maintain. And I believe, this could be only be done, in a close work of the whole EU in this case.
Yeah. Thank you. Thank you very
Thank
much.
you.
Thank you. Professor Šuvada, how can WHO work with countries in Central and Eastern Europe to help ease this radical reimagining? Are there multilateral initiatives that can serve as useful examples?
WHO is here to establish the framework for cooperation with the countries, because WHO itself is the member states-driven organization. And the collaboration is one of the key pillars since the very beginning. The second issue which I would like to perhaps share with you is that WHO is a facilitator of change. And it means that from the perspective of the member state, sometimes we don't see what is really beyond the borders. And the collaboration and facilitation through the WHO is helping us to understand where we are standing and where we could go, where the good approaches are in different or similar contexts. And then we can use WHO also as a catalyst of change. And this is very important because WHO has the capability and also the opportunity to bring experts together, to create innovative either hubs or the laboratories or platforms for not only the discussions and finding out where we are standing and what is the status quo, but where we should go, what is the right direction, and what kind of either resources or the opportunities we do have and we can use for this. And WHO is also a partner for innovation, because sometimes we are thinking that we are living, for example, Slovakia, where I'm coming from, is living in the European Union. So we have to just think within the context of the European region. But this is not the case, because there are many other great countries which are having really good policies implemented in the practice for perhaps many years, or they are really coping with more difficult situations than my country does. So it means that the international collaboration and partnership doesn't have borders as well. So multilateral collaboration is key, definitely. And I'm very happy to share that also on behalf of WHO, there are successful collaborations either with European Commission, as it was mentioned already, and also with African Union, which is really very promising recently. African Union is coping not only with mpox, because everyone is recently hearing about it, but also with many other things related with the indicators of the poverty or linked to the poverty in many countries. And they are trying to change the health index of the countries. And they are having very promising models which we can use also in CEE countries as well.
Thank you very much. Thank you. So clearly, there are roles for health systems to partner with industry and to build upon the natural partnerships that exist to address the gaps in investment and innovation. I'd like to turn now to Ms. Schudel and Dr. Kunow to get your insights, please.
Thank you, Marian. Thank you for inviting me to GLOBSEC. It's actually my first one, and it's a pleasure to be here. A lot of good points have already been raised. I can definitely relate to many things that were said. And I'll pick up on the point of collaboration. I do think collaboration is going to be essential if we want to deal with some of these very complex long-term problems. And that collaboration has to be also between the public and the private sector. And if we come together, we can unlock the value and potential of what each expert partner brings to the table to really look at the problem holistically. When it comes to investment, we do have to shift the way we think about healthcare as just a cost on budget versus a strategic investment, not only in the patient outcome of their health and well-being, but also how that contributes to wider society and economic growth, how that patient can go back to work, how they can contribute to society, how we can take pressure off the care and also the health systems, which are increasingly facing burdens. So I do think we have to look at that holistically and make sure that we're really understanding the needs at the local level. And as a multinational company, we work in therapeutics and diagnostics, and we spend a lot of time at the country in communities understanding what the health system needs. And our industry brings more than just the innovation. That's our core expertise. It's to innovate and make sure that we're delivering for the needs of not just today, but tomorrow, but also working on health system to say, what does it take to get that patient through the whole journey? And how do we make sure we're increasing screening and diagnosis and early treatment? It's not just about spending more money, it's about spending it more wisely. So if you're catching a disease early, the outcomes are better, not just for the patient, but also for your investment. And finally, I'll just say that over the next decade, the current innovations we have and the future ones will massively shift in how we manage diseases, non-communicable diseases in particular, and these are the most devastating costs on societies and economies. And we have to look at this holistically in terms of what it means for prevention, for screening, for treatment, and also how we can unlock potential of artificial intelligence to help us accelerate this in a better way.
Thank you. Thank you. Dr. Kunow.
Yeah, I wanted to add to this, but first wanted to echo your comments also. I mean, we should rather look at healthcare not as a cost, but a strategic investment, not only in the prosperity of this region, but also its security. To me, this is fundamental, the reason being, well, I mean, healthcare populations do contribute not only to economic output, but rather drive innovation, technology, advancements, and what have you to drive the security piece as well. Actually, there's data showing, and you may have seen the McKinsey report, that if you keep spending, investing into healthcare at the current rate, healthcare improvements will lead to a boost of global GDP of about $12 trillion globally, which means that we'll see an acceleration of the annual GDP happening by 0.4% year by year. Now, we've been working with governments on two main aspects, basically. The first one is prevention. Prevention, especially vaccination, well, it is associated with a great return on investment. The reason being prevention tends to be more efficacious as well as more cost efficient. The EU's Beating Cancer program is aiming for 90% of girls to be vaccinated against HPV, as in the prevention for cervical cancer to be improved. And according to the estimates of the EU, what this means is if we are able to be successful and get to the 90% vaccination rate, we would see, a huge increase in productivity as well as labor income, by about 60 million hours, as well as $400 million per annum. On top of that, we've been supporting governments in utilizing the healthcare ecosystem even more so, as in driving data and data analytics. The idea being to drive quality care, but beyond, and you mentioned it already, efficiencies in the system, as well as optimization of patient care pathways a great deal. In order to use a data ecosystem, well, there's technology advances, there's AI, there's integration of databases to be done, which we have been supporting to quite some extent in order to ensure that governments can invest more wisely also, as you already said, and so nicely, and deploy those investments where they are needed the most. Right, to give an example, in Czech and Republic, as well as in Slovakia, we supported the development of what we call cervical cancer elimination dashboards or HPV vaccination dashboards. And due to the transparency, as well as the gaps that dashboards have been outlining, we see the VCR, the vaccination rate has been going up by 20% year on year in these two countries. So to summarize, if you keep investing into prevention as well as utilizing the data ecosystem even more so drive efficiencies, I think we'll see not only a greater deal of prosperity kicking in, but also security going up.
Thank you very much. Thank you. I'm just going to ask a question now for each of the panelists to address. And while I'm doing so, please continue to contribute to the Slido word cloud. There are a few words, but many more people in the audience. So please contribute. And if you have any questions, please get ready, because after this next round, I will open the question open to questions from the audience, and you'll raise your hand and someone will appear with a microphone. So you are each from different countries, and along with our audience here and those participating online, we all share memories of the challenges of life under the recent pandemic and how global lockdowns impacted our lives, our routines, our work, our health, our healthcare delivery systems, and including the particular challenges for people living with acute and chronic illnesses. I have sleepless nights over the fear that we have failed to really improve our preparedness efforts, and this is clearly evidenced by what is currently happening in Africa with Mpox. But it's not simply the next disease. The global community must confront the challenges posed by war, by unanticipated crises brought about by economic disequilibrium, migration, in addition to natural disasters stemming from climate change. So I'm going to ask each of the speakers here if you can suggest what must be done to build a consensus for action on health. Who would like to go first? I won't point out anyone unless somebody fails to jump forward.
Please.
Okay. Thank you.
Or somebody nominate somebody.
No, thank you for that, because I believe, this is the Mpox and the situation, around this it's serious disease, definitely. I believe it will not really spread with such an impact, as we had, with the COVID and so on. But it shows definitely that we didn't make all the steps which we should. I see the importance role of WHO in this topic. That's without a question. The pandemic plan and the international health regulations are somehow something, what we need to ensure, it will fly. And yes, then we have to work, on the clusters, which are, let's say, putting us together. And I believe again, if the EU could work on this, in better way, then the results could be much better. And I would like to use one example. We are working under the umbrella of WHO on the Novel Medicine Platform, which is actually, let's say, the tool which would help, the access to innovation to all countries, not just the EU countries, but the whole Europe. Not 27, but 53 countries. And you can see, the differences, and the differences in the focus, differences in the resources. And as EU, we have a really lot of resources. We are, let's say, on the stage which gives us the chance to really, help the rest of the world to move it forward. And if the platform like WHO, can help, to transform what we are already doing locally, it doesn't matter if it is the joint evaluation of the new technologies, if it is the joint purchasing, or let's say the way, how we're setting up, the reimbursement system, the solidarity systems which are built, in the Europe based on the, I would say, the Bismarck systems, with let's say, investing us all to the health, all of us where we will need it. That's something what could really move us forward. And yes, WHO is not the fastest tool, but it's one of the only tools we have, for the pandemic preparedness.
Thank you. Yes, and it's really crucial what you say, because everybody has their unique challenges, but we can learn. The Czech Republic has been good in addressing some issues that could help inform the approach in another country, and vice versa. So it's breaking down those barriers, and I'm seeing more words appear on the cloud, and the most important word there is a word that's close to my heart: collaboration. And I create a sort of a mathematical formula out of words: communication plus collaboration plus consensus building is what equals change. And so they're all words beginning with C, yes, but they all unite together to create the change that we need to address the challenges that we are confronting today and the ones that we're heading into tomorrow. So enough from me. Please, over to the rest of our speakers.
So I'm happy to pick up, and maybe
Please.
we can go down the line. Collaboration is key, and this is what we saw during COVID, that every party came together to do their part. And we are not prepared yet. We need to be better prepared. And even as we discussed the WHO pandemic agreement, my only plea would be to make sure that we're looking at what worked well during COVID and make sure we keep that and we fix for things that didn't work well. And what worked well was the speed of innovation, how quickly we delivered diagnostics, vaccines, therapeutics. The day the sequencing of the virus was done, companies started research. There was no time lost. So I would just plead that we really are careful in terms of what we want to do for future preparedness when it comes to health interventions we need. I also think it's critical that we don't wait for the next infectious pandemic outbreak. We have a real problem at our doorstep today, and that's NCDs.
Yes.
And 74% of all deaths globally are a result of NCDs, and that's about 41 million people a year. 43 trillion between 2010 and 2030. So imagine what we could do as a society if we could better manage NCDs and make sure that we're quantifying that in real terms and how we're putting that money back into economic growth and, of course, value to society.
Indeed. On February 1st, WHO came out with a projection that by 2050, we will see 77% greater number of cancer cases around the world versus what we are seeing today. 77% increase from today by 2050. Now, we've got to address it now. We have to do whatever we can to improve the information we're giving to our communities so that communities can individually maximize their opportunities for promoting their own health, understanding their risks for disease, and doing what they can to modify their behaviors. We need to do a better job of ensuring that we have better screening and early detection, because we can address a number of cancers and other diseases if we are identifying them early. And we need to improve access, financially sustainable access to treatments. We have wonderful treatments today, and there are some super ones coming along for the future. But we have to make them financially sustainable, right? And these are things we can do now to help avert that colossal projection that's been forecasted by WHO.
And then back to infectious diseases. Well, I guess there's more to be done. For me, the key is collaboration, indeed, as you already mentioned. It's probably going to be encompassing all of us, right? Governments, international institutions, the private sector, but then society as a whole also. Look, I guess there's a couple of things, learnings to be considered, right? I think we need to increase healthcare system capacity in order to be able to maintain those services even if a crisis hit. We need to create that always-on type of healthcare in order to get away from that emergency last-minute type of fire squad actions. We may need to do more in the area of disease surveillance, right, through leveraging data analytics to the best of our ability. And then ultimately, as you were already saying, it's about, of course, driving R&D also to innovate and bring to consumers and patients vaccines and antiviral drugs moving forward even quicker. There's estimates, a couple of studies that have been conducted, outlining that we will need to invest about $300 to $600 billion in the coming 10 years, which is quite an effort, but it would more than offset the estimated $9 trillion loss of economic impact, due to the pandemic we've been facing recently. So I think it does require a collaborative effort, as I mentioned before, across all institutions to make sure that we can avoid that from happening.
Thank you very much. Thank you. And last but certainly not least.
Collaboration, definitely, yes. There is no doubt about this. Because also WHO was created as a collaborative effort of the member states and clinicians at the very beginning, 75 years ago. So what we need perhaps to turn our attention to is that we need to understand the challenges as the new opportunities and to turn them to the new future. Because sometimes we are really missing the catalyst opportunities, and each challenge, each crisis is a catalyst opportunity. And catalyst in the way that not only to collaborate as it is mentioned over here, but also to bring new ideas, new solutions, and to break the silos. And the silos, we are working in the societies of the silos because we think that even everything what is related to the health is belonging only to the health sector. But this is a myth because we need other sectors, economics, we need really social sector, we need education, we need all the compartments of the building society blocks. And we need even a young generation with creative thinking. We cannot let them be behind anymore because they are the future owners of the responsibility and the challenges, whether we will be still sitting here and discussing the same issues, or we will really bring something innovative and solutions for future generations and for ourselves as well. And I see that there is really right time today to discuss also innovations and momentum from the pandemics, because we are facing upcoming high-level meeting related to the antimicrobial resistance as one of the components of the biosecurity and biosafety risk mitigation as well. And also certain silent pandemic, because, and here are colleagues who are really having exact data, how much our society and also health systems are spending on controlling. But if we will be really honest, we are not spending on controlling and preventive measures. We are more spending about the treatment and really reacting, not proactively, but reacting on the demand to treat the infections and to save the patients. And we know that those budgets, we should invest in something meaningful, preparedness, prevention, development, and really the innovation, including innovative technologies. Regarding to this, I think that it's very important to have catalyst even for social innovations, to start to communicate trustworthy what is harms and what is pros and cons for each of our decisions and recommendations also in the medicine. We are really not speaking about the harms and possible unknown issues. We are just presenting, and sometimes this is really lack of transparency with the public because we are not translating appropriately what we see as the evidence and what we see as the way forward. So plain language recommendation with understandable language, either on the level of politicians, policymakers, or civil societies, or investors and public-private partnerships. These are really new ways how we need to act, and we need to study it together. There is no isolation. We will not do anything, any change, impactful change, as a single person, as myself or whomever. But we only have to come together, stay good together, and work together.
Yes, thank you very much. Beautifully said. Thank you. I'm now going to open up questions from the floor. Does anyone have a question? Please raise your hand so a microphone can be brought to you. There's a hand right there.
Yeah, hello, thank you for the talk. David Stetson from Europe a Patient. I just noticed in the title of this session, and mentioned numerous times today, post-pandemic, when World Health Organization has said we're still in the pandemic. And we're kind of pretending to ignore it. There's over 1 million people a day being infected in the US at the moment.
Yes.
Over 400 million with long COVID estimated. At a cost, according to a paper that came out a few days ago, of over $1 trillion a year. German economists have stated that Germany wouldn't have gone into recession except for long COVID, the chronic illness. Mm-hmm. But you know, even in the title of this session, we're pretending we're ignoring this. And one of the great, I would say, technical breakthroughs in the pandemic is we've understood now how we can prevent transmission of airborne viruses. And this could have a dramatic effect on public health and costs throughout the world. Why aren't we talking more about that?
It's a very good and very valid question, and thank you very much indeed for asking that, because as soon as we forget that this disease is still happening in corners of the world, that's where we are doing a great disservice for our fellow humans and for the future health of societies. So may I ask you, Professor Šuvada, would you please have a stab at that?
Thank you very much. Without your permission, anything. Thank you very much for a very great question. This is also showing the silo, how we are working and understanding where we are living nowadays. That as a member states, we think that pandemic is over. And also as even the investors somehow, or developers, we are thinking that, okay, so this is not anymore a very attractive topic, but WHO is still ongoing with the work. And also not only the development of the policies and the governance, but also about the development of recommendations. And I can share with you, and I'm very happy to share particularly this topic with you, that I'm part also of the McMaster University collaboration, WHO Collaboration Center, which is related to the impact and evidence and research. And we are developing almost 1 year recommendations regarding to long COVID for kids, for each group of the society with different conditions, but also linked to the social and other sectors, which is really not necessary to explain more. So it is really great idea to be inspired by others. Unfortunately, only Canadian Public Health Institute was funding this, so as the oversight colleagues, we are just helping and we are advisors in this project, but there is a huge amount of work and research done in this field. And many countries, they participate and contribute, including Africa and Asia, with enormous data and enormous understanding what long COVID means for us, for the society, for particular individual living in certain areas with the contextualized environment. And very soon, in a couple of months, in 3 months, actually, we are going to publish those recommendations. And we will be very happy if certain collaborations are also developing in CEE countries, because we see that we have special attitude, we have special history, we have social and economical challenges, but also we have very special needs. So definitely I will encourage everyone to join the research and to join also clinicians who are participating on this, and not forget that we are not over.
Thank you very much. Thank you. I'm going to choose one of the questions that's been contributed on Slido, because I think it feeds into an important word that we haven't mentioned yet today, disinformation. So how do companies, and I'm going to edit this a bit, how do companies, health systems, WHO, CDC, fight ever-increasing numbers and frequency of disinformation regarding vaccines, drugs, and medical innovations? And is this a winnable fight at all? So, how do we deal with disinformation? It's a challenge that I think we need to talk about across society, and not simply put the people, the health experts that we have on the panel today on the spot, because it's something that we all need to address, because our use of social media helps to feed into that, right? We go to the message that's put up on the screen that says some stupid thing about swallowing some sort of substance is supposed to counteract a virus, right? We gravitate to it because it is so outrageous, right? But our gravitating to it expands its presence across our communities, and then it grows from there. It grows like a virus or a tumor, right? So we must try to do everything each in our own daily lives to put a stop to it, right? This is rubbish. This is silly. We live in a science-based world. The scientific innovations that we have seen since the first smallpox vaccine in the 1790s is extraordinary. And it's due to the scientific innovation that we were able to have a vaccine to address COVID-19 in 320 days after the virus had been identified. And it didn't just suddenly emerge in 320 days. It was built on decades and decades and decades of research.
So I don't know if it's a winnable fight. I hope it is. But I think you hit the nail on the head with science.
Yeah.
We have to make sure we lead with science and we don't allow politicization of the science. Because in COVID, we saw politics over-dominating what the experts were saying, and it is confusing for the public to know what to believe anymore. So I know efforts have been taken to control what's being posted on social media, but I think the scientific community banding together and speaking with clarity, with one clear voice, and politicians keeping politics out of science is going to be really critical in the future.
Absolutely. And we
Well,
need to
I presume this is part of the process, right? We are discussing it here, not only to the benefit of the audience here in the room, but probably, well, hopefully impacting also a bigger audience out there. I mean, ultimately, I guess there's a couple of key learnings that we need to take into consideration, right? We've got to be upskilling our game in terms of the communication piece. As in, well, it's got to be an omni-channel campaign, always on also. We've seen in a couple of countries where there's big anti-vax movements happening. As soon as you get a message out into the public domain, you see the anti-vax push back on it heavily. So it's got to be like always on, and probably driven by artificial intelligence also, the idea being to identify those pockets where you need to still need to convince and convey the message, engage with the audience. It does require a constant effort, right? And then we need to put a big investment behind all of us, I believe, in order to drive that communication vis-a-vis those stakeholders that are not necessarily against, but don't fully understand the concept and the science behind.
Yeah, and we need to increase the scientific education. I think one of the big failures during lockdown was we could have had all of these public service announcements on television to increase the understanding of science in our communities. We need to increase the education of our children into scientific terms.
We've been investing a lot in health literacy, basically, right? And it is an ongoing effort.
Yeah.
And I hope we'll be able to win the fight ultimately. But further investments to be done.
Well, thank you. We have just a few seconds left. I'm going to pose a question and ask each of the panelists to come up with a nugget in an answer. So we can easily, as I said, continue this conversation for the rest of the conference. But of course, no matter how much I would like to do so, we can't. But as we close, could you each give us an assessment of what we need to do today to improve our options and opportunities for the future? So may I start with the Deputy Minister?
I was thinking, when doing this nice discussion about the disinformation and so on, it just reminded me the time, of the COVID. And I mean, every expert I saw in the television has a different view on the topic. So we have to really, educate the people, including the experts. I believe, that the experts, who is not 100% sure, what is placed at the table, then can make quite a damage. I believe it's a role of the universities, to train our GPs, and medical professionals, because the one, who is really seen as key for the transmission of the information about the health is, of course, the GP. Or the pharmacists, I don't know, those who are in closest contact with people. So I believe this is something what we need to build on it. And yes, again, what was already mentioned here, and I see it, for example, I know in the discussion under the umbrella of European Commission, the Critical Medicine Alliance, we have to somehow create the channels where the industry, academy, patient groups, and medical scientific societies, jointly with governments, find the space, the safe space, some kind of sandbox, where the topics can be discussed and the solutions are somehow pre-agreed.
Thank you. Yeah, thank you very much.
Well said. I would say so many important themes in such a short amount of time. I would say there's a glowing research and evidence base that shows how health is an investment for economic and secure prosperity. And we're going to need economic growth if we're going to deal with all the challenges that health demand is posing for the future. So I think it's everybody's business. We need to be better at talking about it, at measuring it, and bringing all the relevant voices in the room. The Minister of Health cannot do it alone. It requires all ministries and even the head of state level and all partners across the sector. So that would be my takeaway.
Excellent. Thank you very much.
Well, I don't have that much to add to it because I think the important stuff has been said. I wanted to reiterate, though, that investment innovation is going to be key here. Without innovation, we won't be able to stay competitive nor build that healthcare resilience required moving forward. And it goes well beyond healthcare, of course. We mentioned several times during the opening panel this morning, these countries will be driving innovation a great deal, and advancing innovation will probably be leading the pack. And I think this is what we need to be doing.
Thank you very much. Very important.
No one should be left behind. Until everyone is on board, no one is safe. And I think that this is also a key takeaway from my side, because we need really empower communities. We need to be, as individuals, living and working with and within communities to understand their part of the responsibilities, but also part of our governance bodies, let's say, on behalf of member states, but also international collaborations in either in private sector or the international organizations, science, and so on. We need to let them understand what we are talking about. Sometimes they don't have a clue. We need to use plain language recommendation to help them to be on board and not to be left behind.
Thank you very much. Very well said. And I'd like to thank the GLOBSEC organizers for recognizing that health security is a national security issue. And I really hope that we can see the health focus grow in future years because it is so crucial. I'm sorry I've eaten into a few minutes of your coffee break, because there is now a short coffee break. And then in this room at 4:10, the program continues with a chat with Karol Havlicek, who's a shadow prime minister here in the Czech Republic. Thank you all very much for coming, and I hope it's inspired some thoughts for you, and look forward to seeing you in the next days here at this conference. Thank you.